Welcome, aviators, and thank you for joining me on my show today. And happy Friday, or whichever day you're watching this on. I'm Hollie Bellino, and I'm your host of the Aviator's Guide. And today I have Dr. Mark Hammonds joining me, who is my esteemed guest and an actual aviation medical examiner. Sir, thank you so much for joining me today. I really appreciate you being here today.
I'm looking forward to it.
Dr. Hammonds has actually been practicing for over 30 years, and he has 5-star reviews on WebMD. So he's a pretty good guy to have with us today. He was actually the first AME I ever went to back in 2020 for my first medical, and I remember it vividly because his office is so funnily decorated with pilot decor. And he had the best stories to tell because he is also a pilot himself. So I will always remember that first visit to your office.
Well, thank you. Yeah.
First off, just tell us a little bit about yourself, sir.
Well, I am a family doctor, and I've been in practice since 1992. It was shortly after that I started doing flight physicals. I have to admit, mostly because I heard you could write off your airplane if you did flight physicals. And I actually got audited a couple years in, and they go, "Why are you writing off $50,000 in flight expenses?" And I had everything from the FAA saying they wanted me to keep my pilot's license, to understand the rigors of what it takes to be a pilot. And I had all the documentation, and says you got to fly. And I go, yeah, and I'm not going to rent a cheap airplane and risk my life. So unfortunately, Trump changed all the rules.
Oh,
right
really?
when I bought a really nice airplane, and that same year you can't write it off unless you run it through your company, and my company doesn't want to be involved in the airplane.
Oh,
so,
I bet.
So I can't write it off anymore, but
now you love it.
Yeah, no. Yeah, I've had planes continuously since probably 95, one at a time, and I've got a nice Cessna 421 now, which is probably my last.
Do you take your family out on flights with you?
Yes, yeah. We don't use it enough to really justify it, I hate to say, but it's a toy. But we go skiing as our big thing.
Well, you have 2 kids, right?
2 kids. I have an older one from a different life who's 31, but right now I have a 12 and a 17.
Oh, okay. Are either of them interested in being pilots?
I don't know about professionally. My daughter's taken a couple flying lessons, and since I turned 61, I go, somebody else needs to be able to land a plane just in case something happens.
That's good.
I'm healthy, but so I'd like to at least get her, soloing at
Absolutely.
some point here. Yeah.
That's always good to have another safety pilot in the plane with you.
Yes.
If you never feel comfortable by yourself, always get a safety pilot to fly with you guys. So when it comes to doing the actual exam for pilots, is there a checklist that you have to follow that's provided to you by the FAA or someone?
There is. I mean, you go through training every 3 years, and they get very specific about what they want. And on the form you fill out, there's a box for every single organ and every single thing on there that you check off. Most of the people are 20-year-old, perfectly healthy people, so, we don't check prostates and do everything. A lot of it you determine by the history and write down. If they wrote down they had a problem, you check that extra well. You're really checking the vision, the history, the medication list, make sure they're not taking something they're not supposed to be on. The actual physical for a young, healthy person is actually fairly easy and brief.
I do remember mine being pretty easy, so
yeah.
I have heard other people have had more difficult physicals, so those exams change depending on if they're under 40 or over 40 as well, correct?
Well, you listen a little more carefully if they're older. If they're 20 and they're healthy, I mean, you can listen to their heart for 15 seconds until it's okay. As 80-year-old, you might try and find something a little bit more. I've passed some people in their 80s, and I go, "Ooh, I don't know if I'd fly with them," but if they don't have any health problems, you're not supposed to discriminate.
Once they complete their biennial flight review, it can be determined in that time too if someone does not want to sign them off for that.
Yeah,
so.
If they're not safe, they're not going to sign them off, I'm sure.
Yeah, absolutely. So the medical doesn't really change much if you're under 40 versus over 40. There's not any additional requirements you have to complete if they are over 40?
For first class, there are. That's the difference. First class is if you're an airline pilot or professional pilot, you have to get an EKG every year.
Right.
First class, you have to have 20/20 vision. For third class, which what I fly with for your private plane, you can be 20/40. As long as you can pass your driving test, you can pass the flying test on there.
What do you have to say in regards to other AMEs out there? Have you heard how some of them tend to have very intense physical exams when other portions of it may not be necessary? As you mentioned, sometimes the prostate exam is done when it doesn't seem to be necessary.
Well, nobody wants a prostate exam. Now, they teach in the class, it's not required. some of the guys, it may be the only physical they get. You know, if they're over 40 where you're supposed to probably do one, and you say, are you getting regular physicals somewhere else? And they say, no, you're my only doctor. It's not required, but you might offer it at that point on there.
Okay, offer
you should,
it.
You
Okay.
should have a prostate exam. You want to do it. It's
Right.
not required.
Yeah, it's just smart.
And I'd say 50-50 whether they go, no, I'm fine, doc.
In your eyes, what is something a pilot can do to be the most prepared for their medical exam with an AME?
Well, if you're perfectly healthy and you're not on any medications and you don't have any diagnosis and you haven't been in the hospital recently, you don't need to do anything. Get a good night's sleep, eat a nice breakfast. Don't go to IHOP and have the tutti-frutti breakfast, because if some sugar shows up in your urine, then we have to do a sugar test on you, and it might not be anything at all. If they have a urine that shows up with sugar in it, you do a finger stick glucose. And if it's perfectly fine, then, I've had some people stop at IHOP on the way in, and I go, don't do that. It's a physical, man. Try and get a good night's sleep. It's funny how many people, young healthy people, come in and their blood pressure's high. Fortunately, with the FAA, you can be a little bit high and you still pass. I think because they assume you're nervous.
Oh, yeah.
Everybody's career is on the line, and most of the time, we lay people down. We put music on, and I'll give them 30 minutes, and if we can get a legitimate level that passes, you go, man, you probably ought to watch this and see your regular doctor, but you passed today. So, get a good night's sleep and eat a decent breakfast in the morning. Now, if you have health problems, that's where you need to possibly get some more information on it. On my website, dfwflightphysicals.com, which is kind of down right now, you have to go to dfwfamilymd.com. There's forms. If you have hypertension, you can download the forms. If you have diabetes, there's forms. If you go to the actual FAA site, any disease you have, there's a form on there you can download and bring it to your doctor. Like if you have asthma, it tells you what you have to bring me that I need to pass you. And if you bring those information, a letter from your doctor saying you're fine on it, then it's a slam dunk. If you don't, then we have to request it. If you don't get it to me in time, I have to defer it, and then you get caught in the FAA loop, which could take months to get your physical.
Pilots who have diabetes and asthma, and are there any other kinds of conditions like that they can still get their medical even if they have those?
Yeah, if you think you could safely fly, you probably can. Less than 1% of people fail. The things that obviously you wouldn't want your pilot to have be a passenger,
right,
then they're not going to pass you. If you have seizures, if you have bad diabetes and you're on insulin and your blood sugar's getting low and you're going back and forth to the emergency room, that's not going to work. If you've had a heart attack and not completely checked out and cleared by everybody that's seen you, I don't want to fly with you if
right,
I can't land the plane. Right. As long as it's something that you feel safe, then it's probably worth pursuing. And the odds of you failing is less than 1%. But you might have to bring in every record that you've ever had for them to review on there.
That sounds about right.
Yeah.
Have you ever dealt with a pilot who has had to get a SOTA, a statement of demonstrated ability?
Yes, absolutely. Very few, to be honest. I don't know if it's called a SOTA if you're colorblind. You just get a letter saying that even if you're colorblind and you come in, it's amazing how many people come in and don't know it. I used to, and for DOT physicals for driving a truck, I just go, what color is this? Red. What color is this? Yellow. What color is this? Green. You bet. Now for pilots, they have the pictures with the dots on it, and I can see it perfectly, but people going 27, 29, it looks like a 2, and I go, that's colorblind. And it used to be a lot more critical, I think, for they had GPS and everything. I know you've flown at night where there's just lights everywhere.
Oh, yeah.
And I remember the instructor going, see the green light over there? And I'm going,
you're lying.
There's like a million lights over there. And if you
light.
were slightly colorblind, you might not be able to find the airport. Now you just hit the GPS and it takes you over there.
Oh, yeah.
So, but I don't think I've had a pilot yet who came in, failed the color vision test, and then went and got the special test that the FAA wants and didn't pass it. And once you pass it, you just have a letter saying they passed the lantern test, Farnsworth lantern test, I think it's called. Or you go up and they shine lights at you, and if you can see the colors, they pass you. And then the rest of your career, you just write that down. I'm colorblind, but I passed the test.
Okay, so they have to go do the test first, and they come to you saying that they passed the test for their medical.
Ideally. Most of them come to me, didn't know they had it.
Right.
and I passed them, but it has a statement on there saying you're not allowed to fly at night or by color. There's a specific thing, by color lanterns if they're doing it. But you could fly, take your lessons, start your thing. I wouldn't put down my $80,000 for lessons yet till I got the thing in my hand.
Right.
And then you call the FAA and we give them the number and you set up this test. And like I said, nobody so far has failed it.
And Dr. Hammonds makes a really good point on that, because you don't want to start your flight training until you get that medical in your hand, as you don't have to have your medical until you do your solo flights as a student pilot. So make sure you go and get that exam first from an actual AME before you start spending your money on that training.
Yeah, I get people that I have to defer, and I tell them, I go, I could guarantee you're going to get your license. So you could go ahead and start taking some lessons. Worst case scenario, you got 10 hours of flight time and you wasted that, but go ahead and start. You're going to get it. You only need the certificate when you're ready to solo on there, but don't hand them $75,000
right.
until you got the thing out there.
Yeah.
So I want to go an hour at a time for now.
Well, that's very nice for you to assure them of that if you know for sure that they can do it. Like, okay, just go ahead and get started, but it'll be a little bit.
Yeah.
What are some of the biggest issues you have had when giving medicals to pilots in the past?
It's pretty awesome that almost everybody passes. One of the big things, I guess, that would hold people up if they came in and they're on antidepressants. It seems like it's about 10 years ago they changed the rules, but before that they said if you're depressed enough to need a medication, you probably shouldn't be flying till you're better. So someone would come in and go, well, I got divorced 2 years ago and they put me on it and I don't even need it anymore. Life's great. And I believe it's still that way now. I'd say you have to stop it. Call your doctor, tell him you stopped it, have him put it in the chart, and then you have to go back 90 days later and have the doctor write you a letter saying he's been off the medicine for 90 days, he's doing great, and he has no signs of depression. And of course they'd want a note just saying that you weren't suicidal or homicidal when they put you on it, or else they might make you go get some psychiatric testing or something.
Okay.
Now, and I wouldn't quote me on the rules, if you've been on it for a year and it's one of the approved medications, which is like Prozac or Zoloft or Celexa, if you've been on it for a year and you're stable and your doctor writes you a letter saying you're doing great on it, I think I still have to defer it. I haven't had anybody come in with that, but you can pass and you can fly on those medicines. Hundreds of pilots, professional pilots at the airlines who were on these medicines and lying about it, and the FAA knew that, and they actually come up with an amnesty thing for a while. They just watched it and they said there were no accidents or no problems, and we know a lot of these guys are taking it, so we're going to give an amnesty. If you report it to us, even though you lied to us for years, we'll forgive you, but you got to get this letter from your doctor. And so that takes some of the stress away. But I do believe there's still that problem now. If you've only been on it for 6 months and you're not stable, that there may be a window in there where you can't pass. I should have looked that up before I came here, but I haven't had anybody present that window. If it's just been a few months, I know that's not going to pass. And it'd be better to get off it if you don't think you need it. If it's been 6 months and you'd like to stay on it, there may be a little window in there.
That's news to me. I didn't know that pilots could still retain their medical if they were on antidepressants, but that's good to hear that the FAA is starting to become more lenient about pilots who need to be on antidepressants and making it not such a taboo. But I know there are still pilots out there that are scared to mention it to their AMEs for fear of not only losing their licenses and their reputation and their entire career. Currently, we've been going through a couple of issues with pilots' mental health. Taking in light of recent events such as the airline pilot who tried to shut down the engines mid-flight, or the student pilot out of ATP in Addison, Texas, who single-handedly stole an aircraft and proceeded to intentionally crash it into the ground. How do you feel about those situations in regards to the pilot's mental health?
Well, it is a tough thing as an AME. People that present and tell you about it. I've had a few people where you're just going, a little off. I don't know, and it'd be very difficult to do an evaluation, a full psych evaluation on somebody that's perfectly healthy otherwise on there. Pilots are people too, and I think 25% of people wind up on an antidepressant at some point in their life. Probably another 25% could use it. Yeah. Don't take it. The stigma's gone. Most people, it would make you a better pilot. To be at peace with the universe and not anxious and depressed all the time.
It's not so unknown. According to the CDC, over 1 in 5 Americans have some sort of mental illness. So it's not like it's unheard of.
Yeah, it's a little scary.
Is there a process for if you feel like a pilot needs to have a psych evaluation? Would you send them to a specific doctor to do that? Or how would that work?
Yes. That's one of the tough things when you go through training. They really want you to. If you just don't feel comfortable with somebody, just say, I I don't feel comfortable. Fortunately, that's never happened to me where I was that worried about somebody that I would not pass them. But if somebody's doing strange stuff, I'm going to defer it. And you write in the box, pilot needs psychiatric testing. He was, saying strange stuff. That's the good thing about being the AME. You don't ever really deny anybody, but you defer it with your suggestions, and the FAA guys in Oklahoma make all the decisions.
When you defer it, it's not necessarily saying, no, you're not going to get it. You're just saying this pilot needs additional attention, but that doesn't mean that they're going to fail their medical.
Correct.
Usually, right?
Correct. Yeah, there are a lot of things the FAA has gotten better that they, if it's a slam dunk, if somebody's got high blood pressure and they're well controlled and they have a letter from their doctor saying they're fine and they have no side effects on the medicine, you used to have to send that through them, and they go, we don't want to see that. Everybody that comes in, we pass. So that's why I say there's forms online for every disease, and it's called CACI.
Can you spell CACI for the viewers in case
you CACI.
CACI. Okay.
What that stands for, I'm not sure. But if you have everything on that CACI sheet, I can pass it, and I just write CACI approved hypertension. Okay. Now, if you have diabetes and it's your first physical, even if you got all the stuff and you're well controlled, I'm supposed to send it to the FAA and they approve it. So yeah, if you're well controlled and you're not having low blood sugar episodes and you don't have numb feet and bad vision, you'll pass, but it has to go through there. The same thing I think with the antidepressants. If you're stable and you have the letter, they just want to see it over there before I pass it on there. So certain things they've held the power, and other things they don't want anymore.
Okay, that makes sense.
Nobody's goal is to keep you from flying.
Right.
If you're safe to fly. There's a lot of paperwork sometimes, and I think if they don't like your illness, the FAA probably mad at me for saying that, is they require so much stuff they hope you give up on there. Oh. And if you keep sending it and do your due diligence and you qualify, you will pass eventually on there. But some people, they require every record you've ever had, and if it's not, that's one thing I say, they'll send you a list and they tell you exactly what they want, and they want everything on that list. If you miss one thing or something, they'll send you a thing, or you didn't send it, and and they'll extend it, your timeline, but they're not fooling around. If they ask for something, they want that on there.
Have you ever had to deal with any pilots who have gotten a DUI or DWI, or can you still retain your medical if you have gotten one of those items?
Yes, that is a very common thing on there.
Oh, wow.
That also is one thing I'm supposed to defer. If you have a DUI, everybody who drinks when they're young probably could have got a DUI at some point, I hate to say. One time is just bad judgment. Twice, they start wondering if you got a drinking problem. And third one, they probably assume you're an alcoholic, and you're going to have to go through all kinds of alcohol testing and training and stuff like that if you want to keep your license. So one, don't get one. It makes it a lot easier, but I have to defer it. They will look at your arrest record. If you were barely over the limit and you have an excuse, that's better than if you were 3 times the legal limit and punched the cop. But I haven't had anybody with one who didn't eventually pass, and they'll send you a thing saying don't get another one.
Right.
And it's amazing how many people I know get 2 of them, especially with Uber now. There's no excuse for it.
There's no reason.
Yeah. One usually is not a problem on there, and a lot of airline pilots have had one on there, and as long as they're assured you don't have a drinking problem, one could have happened to anybody.
So that's an automatic deferment as soon as you see that. Do you ever find that pilots try to hide that from you? Are they able to hide that from you?
No, hiding things is a very bad idea. Like I said, very few things, once you get through the paperwork, you won't pass eventually on there. They actually do a database search for the traffic offenses like that, and if you didn't report it and they find it, it's a felony. It's lying on a legal record on there. And I've even seen a couple things over the years where they legally pursued somebody for a felony for lying on their things on there. We had a big thing recently where military pilots, when they were getting out of the military and they have disability, everybody seems to get some disability for aches and pains and things, and they reported they got a 40% disability, but they didn't write on there that 10% of it was for anxiety or depression or something like that. I got for my shoulder and my foot, and I got blown up on my toe, and they didn't write the disability. And they actually got FA guy they put in charge of reviewing all the records from military pilots. And I had one guy who they caught with that, and he was an airline pilot, and he took his pilot's license away for a year.
Oh, wow.
Because he didn't disclose it.
Wow. So if he just disclosed it, it probably would have been all dandy.
They said he had nothing on there that would not have passed. They just needed to know about it, and the fact that he didn't disclose it was a deal breaker. So they're looking for honesty, and they don't want to have to search people's records to find something, and when they do, it makes them mad, I think. Just close it, go through it. Once you get it through the first physical, every physical after that, you'll say, oh yeah, I've already disclosed that, they know about it. And I just write down previously disclosed and approved and no problem since. And you don't have to send the records every physical.
Oh, okay. Well, you hear that, guys? Let's not be a felon and let's not lie on that thing. So being a pilot yourself and an AME, are there any words of advice you have to current or aspiring pilots?
From the AME standpoint, especially the people I have who come in and I have to lay them down 3 or 4 times and sing to them to get their blood pressure down. I go, you got to fix this, get healthy. I mean, if you're going to invest that much time and money, you're 20, you get away with it. But when you're 40, if you have a heart attack, your career could be over. So stay healthy, don't get a DWI, and be very professional. My first plane I flew since I was 16. But I didn't have any money, so I'd fly and I would work at Pizza Inn and I'd save $50. I'd go take a flying lesson. I got my license when I was 18. By the time I was 30, I had about 80 hours of flight time. And, I would go every year and get my biannual flight review, and the guy would sign me off, and I go, I hadn't flown in 2 years. You made 3 good landings. You're good.
Hey, that's pretty good.
Yeah.
I mean, if you haven't flown in 2 years, you can still make a good landing. That's,
152s
really
are pretty forgiving. But then my first plane, I bought a Piper Lance from my neighbor. And it was awesome. It was a great plane. I was flying it back from Houston, and it shuddered. And I knew something had happened, and I had my family in the plane.
Oh.
And so I changed gas tanks, and nothing happened. And you could tell the manifold pressure went down. And I was 10 minutes from Arlington Airport where I was going.
Oh, so close, but so far.
And then I hit the auxiliary fuel pump on, and the manifold pressure came up. And I go, okay, it's good. I'm going to make it there. Nobody else noticed anything.
So no one in your family noticed what was happening.
Nobody
They're just
knows
sitting
what
there,
happened.
happy day, and you're over here.
And then I passed Midlothian Airport, perfectly good airport, going towards Arlington. And then when you slowed down, it burst into flames. And fire was shooting out the cowling, and then you cut the engine, and I turned towards this field and didn't make that field. I made this other field and landed it, and then rolled, and there were trees, so I went between 2 trees and ripped the wings off and jumped over a road and missed cars by 15 feet and skidded out in the pasture. Nobody got a scratch.
Thank goodness.
And I wasn't going to fly again. I was standing there by the plane, and somebody goes, man, if you had 2 engines, you'd have been fine. Yeah.
Shoulda, coulda, woulda, right?
If I had 2 engines, I'd have shut the one down. But the lesson I go is take it serious. I didn't do everything. I landed the plane, which is better than some people do.
Right.
I saw a video of my plane just yesterday. He had both engines quit, and he plowed into a building. I think he survived, which is good. But
wow,
wasn't a good landing. It looked like he kind of stalled into it. I don't know.
There are also more fears with twin engines as well.
Yeah,
like VMC.
But I didn't have the checklist memorized. I didn't turn off the electricity before you landed. I don't think I even turned off the gas. I hate to say, I just shut the engine down and the fire went out. But know the checklist, treat it serious. Now I've got a map of the airport and the land around it to know where I could put it if it quits, because you don't have time to think about it when it happens. You've got to be thinking about it ahead of time. When I was young, I used to dogfight with my friend and do stupid stuff and do loops in a 172 and stuff that just not smart.
That your wife would not like.
When you're older on there and stuff. So treat it like a professional, because shit happens.
So if you could go back in time, you would have landed at Midlothian.
Yes.
In hindsight,
it might have still been on fire, but probably once it got on fire, you shut the gas off,
right?
And it would have been fine on there.
And this is a reason why I've told all of my students, you know who you are, to review your emergency checklist at least once a month, because if you don't, you're gonna forget what to do, and it's common. Everyone's gonna forget if you don't constantly review it. Just go over engine failure in flight, on takeoff, approach, just the emergencies that you need to have in the back of your mind. So in case it happens, you can just kick into gear and do what needs to be done to get safely on the ground. This may be the same story I think you told me when I went to go get my medical with you 4 years ago. You mentioned that you were wearing sandals and you would never wear sandals again because of the fire. Is this that story?
For a couple of years, I had a flame-proof Nomex suit and fireproof shoes, and over the years, I've gotten complacent again.
And now you're like, I'm good now.
But I don't wear sandals when I fly anymore, but just in case. But everything's not fireproof anymore.
Right. So review your emergencies and don't wear sandals.
I love doing flight physicals because I get to pilots talk to people, and we talk about flying and things. Most of my patients are runny noses and physicals and high blood pressure, and when they got a pilot, it's fun. I've got some characters that are pilots for sure on there. I'm probably going to retire sometime next year.
Oh, wow.
And
okay.
I've got a new guy who's doing flight physicals at the office. He's been doing them for 2 years. He's not approved to do first class physicals yet, which is a lot of my practice. So I'm hoping we get him approved by the end of the year. We'll still have the same dfwflightphysicals.com website and the same staff and everything. So it should be fine.
Okay, well, that's good to know. Okay, well, if you guys want to go see Dr. Hammonds, make sure you do it within the next year, and then after that, I'll be his next guy. Okay, cool. Do you have anything else that you'd like to add?
No, I'm going to go fly after this. So it looks pretty and nice, so I'm going.
It is a very nice day. Very nice day for VFR. Visual flight rules, right, guys, at VFR. All right, well, thank you so much, sir. I appreciate coming in so much, and I hope you guys enjoyed this episode of The Aviator's Guide. Don't forget to subscribe to my YouTube channel, and if you're watching it on YouTube, like this video, and if you are listening to your favorite podcast platform, then go ahead and follow, rate, and review my podcast. Thanks so much for tuning in, guys, and I will see you next Friday. Have a great weekend. See you later, aviators.